This video is going to be talking about babies being born addicted to opioids. This is Bailey Howell along with Alyssa Vosberg, and this is for our first year seminar 207 class here at Western Oregon University. Enjoy this video. Today we are going to be talking about opioid babies and exactly what they are, women in a general sense as well as pregnant women, how often babies are born addicted, and the outcomes of babies being born addicted, neonatal abstinence syndrome and exactly what that is, how the milk itself can affect the babies, ways to overcome the addiction, and what happens legally if you're a mother of an opioid-addicted baby. An opioid baby is a child that is born addicted to some sort of substance due to the mother's misuse of that substance during pregnancy. A lot of the time, doctors can't fully tell if the baby is suffering from withdrawal until 5 to 10 days after it has been birthed. Some ways that they can tell if the baby is suffering from withdrawal is if it has a fever, sweats, tremors, vomiting, dehydration, and mottling, which is blue, blotchy, pale skin, as you can see on the baby on the right. This shows the difference between a normal baby after birth and a baby addicted to heroin after birth. We want to show the difference between the two babies to show that the heroin-addicted baby has blotchy, blue, pale skin, while the other baby has a more natural color. It also shows that it must be connected to a breathing tube in order for the baby to function. Aspects of a healthy baby include it coming out of the womb crying, it calms down to the tone of your voice, and it's able to gain weight. Looking at the graph on the right, it shows women in general who have overdosed on drugs, including prescribed opioids, synthetic opioids, and heroin. As you can see from the graph, the numbers have been increasing over the years. Although this graph displays just the number of overdoses, there are even more women addicted because not all who are addicted end up overdosing. Also looking at the graph, you can see that the numbers are increasing for overdoses. So that means the number of women addicted is also increasing. The increase in addiction is dangerous for women because that addiction can lead into pregnancy, which could potentially harm the baby in many ways, including what you saw on the previous slide with the effects. Women using opioids are affecting more people around us than we may realize. 1 in 3 women between 2008 and 2012 had an opioid prescription, so opioid use during pregnancy is not uncommon, because if those women were using it before becoming pregnant, they are at higher risk of continuing use during pregnancy in order to help with the pain of carrying a child until birth. We are showing how common that is, showing how 1 in 3 women in 2012 struggled with this. This figure shows that babies are growing all the time in the womb, so there's never a good time for a woman to use opioids during pregnancy because it can hinder the growth and health of the baby. Every 15 minutes, a baby is born addicted to opioids. To show how quickly that time feels, we are comparing it to taking a shower or to how long it takes people to eat dinner, because the average amount of time it takes to do those things is about 15 minutes. The comparison is important because most people think that 15 minutes feels like a long time, but when comparing it to everyday tasks, you realize how actually fast that feels. The first graph on the left shows maternal opioid use using the pink line, which as you can see has continued to increase over the years, as well as babies being born with NAS, which you will learn about in just a few moments. The graph on the right shows the cost of NAS over the years, which has also continued to increase.
The long-term outcomes of being born addicted to opioids are poor social engagement, poor attention spans, and less social responsivity. These outcomes can also occur with alcohol and caffeine. Methadone is used to detox babies from opioid addiction, and these issues from opioid addiction can appear as soon as birth to even your teen years. Neonatal abstinence syndrome is a condition caused by a baby being exposed to drugs before birth and suffers withdrawal from it. The effects include crying, irritability, poor sleep, tremors, hyperthermia, loose stools, yawning, sweating, nasal stuffiness, sneezing, and even seizures. As you can see in the graph, the number of babies with NAS is increasing each year. After the baby is born and happens not to be addicted to the substance the mother used, the baby can still get addicted to opioids because of the mother's milk. The milk produced by a mother who has been or is addicted to substances will be given to the baby as well. The milk can give adverse side effects such as addiction, fever and sweating, and sometimes even death. Some companies have come up with a drug that helps wean the infant off of the opiates that were given to them through the breast milk. There are also programs for mothers to get help and get their breast milk back to normal so that they can continue to breastfeed. This image shows the steps of treatment, first being detoxation, then rehab, sober living, and aftercare. Sadly, the relapse rate after treatment is 85%, and within treatment, 2/3 of the people relapse. This shows the difference between inpatient rehab and outpatient rehab. The pros of inpatient rehab are the patient stays in a facility, has a higher success rate, it is more expensive, it's not disruptive to daily life, 24-hour medical and emotional support, 28 days to 6 months program, designed to treat serious addictions, no distractions of everyday life. Some pros to the outpatient rehab is the patient stays at the home but goes to treatment every day. It does have a lower success rate, it's more affordable, patient maintains a normal daily routine, accessible to social circle support, 3 months to over a year program, good for someone with mild addiction, and 10 to 12 hours a week. Overall, inpatient rehab is proven more effective. Many lawmakers believe it is a criminal act to endanger the safety and life of an unborn child through illegal drug use. Tennessee is the only state in the country that does something about substance abuse while pregnant. This is aggravated assault, which can result into 15 years in prison. In conclusion, we have found that the differences between a baby born healthy and a baby born addicted to drugs show a major significance that should give inspiration to all mothers to stay drug-free during pregnancy for the sake of their baby's health. We also discovered the number of women in general who overdose and how that number is only a piece of the number of women who are addicted to drugs. We then showed how these numbers of women relate to pregnant women. We also showed how often drugs in pregnancy actually occur, because it is more than what people may think. We also talked about NAS and what it is and how it affects the babies. We then showed how it's more than just the pregnancy that can affect the baby, even the milk can cause health issues. We also showed how to overcome addiction and what exactly the steps are to recovery. Lastly, we showed how mothers of opioid-addicted babies are being held accountable for their mistakes.
This is a phone number and website for Advanced Recovery Solution. It is a licensed drug rehab center with 24-hour admission and immediate addiction help. So if you or someone around you needs help, please give a call or visit the website. Finally, these were the websites we have used to help us create this presentation. Thank you for listening, and I hope you learned something, and I hope you enjoyed our presentation. Thank you.